Back to our talk. Like any other organ in the body, blood flows to it through arteries and returns through veins. If we look at the arterial supply that nourishes the male organ, we find an important artery in the human body called the common iliac artery, which divides into two main branches: external iliac artery, internal iliac artery. External iliac artery. This artery is responsible for supplying the lower limbs or legs. The other branch that concerns us is the internal iliac artery, which supplies the pelvic region. From it, many branches emerge, including the one we are interested in, internal pudendal artery. This artery terminates in something called the common penile artery. So the main artery of the male organ includes, so we have external iliac artery, gives rise to the internal iliac artery. Internal iliac artery gives rise to the internal pudendal artery. The internal pudendal artery gives rise to the common penile artery, which is the main artery supplying male organ. The main artery that supplies the male organ divides into three main branches before it reaches the male organ. Each branch has the function of supplying a specific part of the male organ. The first branch is called the dorsal penile artery, which is responsible for supplying the skin of the male organ, the glans penis, and the soft tissues beneath the skin. It runs along the upper wall of the male organ, above the corpora cavernosa. As we agreed, it nourishes the skin and the glans penis, and is responsible for sensation and pleasure. The second branch of the common penile artery is called the bulbourethral artery. It supplies the spongy body and the urethra. It is responsible for the swelling of the spongy body during erection. The third branch, which is of interest, is called the cavernosal artery. It is responsible for erection and supplies the corpora cavernosa. If we focus on the cavernosal artery responsible for erection, we observe that once it reaches the corpora cavernosa, it begins to enter the erectile tissue and travels along the length of the corpora cavernosa from one end to the other. As it travels, it gives off the branches that you are referring to, which resemble a tree structure. These branches are called helicine arteries. So the cavernosal artery enters the corpus cavernosum from one end to the other and travels along its length. As it travels, it gives off branches called helicine arteries. The helicine arteries are responsible for supplying the sinusoids, which are the blood-filled cavities inside the spongy body within the corpus cavernosum, and after the blood enters these cavities, it begins its circulation within them and then exits through veins. These veins start from a group called the subtonical venous plexus, which drains into very thin veins called emissary veins. These veins penetrate the wall of the corpus cavernosum and then drain into veins called circumflex veins, which you can see. Then it drains into something called the deep dorsal vein, and then it pours into something called the prostatic plexus. This is the blood circulation of the male organ, specifically the corpus cavernosum, which is relevant as it is responsible for erection and the issue of venous leakage. Blood enters through the cavernosal artery, which branches into helicine arteries. These small, thin arteries feed the sinusoids, the blood-filled cavities. After filling the sinusoids, the blood exits into the subtunical venous plexus. From there, it passes into emissary veins, small veins that pass through or exit the wall of the corpus cavernosum. Next, it flows into circumflex veins, then into the deep dorsal vein. Finally, it ends up in the periprostatic plexus, the veins surrounding the prostate. This describes the normal blood circulation under usual circumstances. The penis in its flaccid state has blood flowing in this manner. Blood enters through the arteries and exits through the veins without any issues. The whole story starts with the occurrence of an erection. What happens during an erection?